Hi, this is Willie Nelson from NORML. For 30 years, NORML has provided a voice for the millions of Americans who smoke marijuana responsibly. More than 500,000 Americans are arrested each year for smoking pot. These are ordinary citizens like you and me, whose lives and careers are being needlessly destroyed. To learn how you can help, contact NORML at www.norml.org or call toll-free at 888-67-NORML.
And distributed by the National Organization for the Reform of Marijuana Laws in Washington, D.C. This is your daily audio stash, the growing truth about cannabis. Welcome to the most popular audio podcast regarding marijuana in all of America and all the world, featuring interviews with scientists, politicians, doctors, prohibition policy activists, regular cannabis consumers, musicians, and NORML staff and NORML's board of directors, along with music and comedy no other podcast can offer. You can always find out more about the show at our website, normalaudiostash.com. We're ending marijuana prohibition with education, one listener at a time. Welcome back to the Audio Stash this Wednesday. I'm your host, Chris Goldstein. Take a moment to join us at NORML to end marijuana prohibition in America. Just visit norml.org. And make sure to check out our website today at normalaudiostash.com. Our NORML eBay auction's still going. That photograph signed by Woody Harrelson up there, along with a number of other interesting auctions this week. Well, I have some new auctions starting up this weekend. We'll talk about that on Friday's Stash. Later on today, we'll have our weekly Cannabis Science segment with Dr. Mitch Earlywine. First up today, I've got an essay about a little journey I took yesterday, really like a journey to the Twilight Zone. I went to the White House Office of National Drug Control Policy's Random Student Drug Testing Summit up in Newark, New Jersey. So coming up for you next, an essay about my trip to that summit, and it really was like entering the Twilight Zone. Under the gray industrial skies filled with roaring jets at the Newark Airport Hilton, I joined high school and middle school administrators from around New Jersey for the ONDCP's Drug Testing Summit. The White House Office of National Drug Control Policy's reason for funding this meeting was an attempt to encourage schools to implement random student drug testing for extracurricular activities. New Jersey already has a statewide mandate that school administrators must drug test students who arouse a reasonable suspicion that they are intoxicated in school with either drugs or alcohol. Yet even with such a comprehensive mandate for drug testing already, the ONDCP was here to try and give away some of their $20 million annual allotment that funds suspicionless random student drug testing. Last year, they were only able to give away about half of that budget. To try and get that money out the door, the Newark Summit, along with 3 others, are happening around the U.S., trying to sell this practice of random student drug testing. Listening to the presentations, one can see just why it is such a hard sell. Opening the show was Dr. Bertha Madras, who's considered a rank general in the world of prohibition enforcers. Using some rather twisted and outdated research, along with a few scare tactics student surveys, one might get the impression from Dr. Madras that there is not a school in America where most of the students are not currently on drugs. She seemed to focus on 2 things, prescription drugs and marijuana. then went on to heroin to pull at the heartstrings of the audience with stories from parents whose children had overdosed. Dr. Madras assured the audience that implementing a random student drug testing program for extracurricular activities would do the most to protect children. That was the emphasis, protecting children. Yet it seemed that only some students could be protected. The ONDCP can only give money away that puts into place the random testing of students who are actively enrolled in extracurricular activities, not all students. So the kids who are being protected are the football players, track athletes, and members of the chess club. Conspicuously missing from Dr. Madras's presentation was a set of data showing that a random testing program for athletes and others in activities reduced student drug use at any school overall. That data was missing because it simply does not exist. Presenting next was a common face for prohibition, attorney David Evans of Flemington, New Jersey. Mr. Evans has brain damage, or at least he thinks he does, from his past use of drugs. That was one of his final proclamations as one of the most visible advocates of both drug prohibition and the suspicionless testing of students for drugs. Mr. Evans instituted a random student drug testing program at his local high school where his children were in attendance. He even volunteered one of his kids for the program because they weren't required to be tested. Going further, Mr. Evans subjected his own kids to home tests. The result, in his own words, is that his kids are, quote, drug-free today, I hope, close quote. The kicker there is the I hope. Mr. Evans' presentation to this audience of school administrators covered the legalese of random student drug testing. To say his presentation was filled with contradictions would be a very gross understatement. For anyone associated with these programs already, the real information was in what Mr. Evans could not avoid mentioning, but chose to skip over very quickly, like insurance. Once a drug testing program is instituted at a school, Mr. Evans suggests the school district and governing board increase their insurance coverage to protect the school from legal costs. Even directors' and officers' liability is suggested to protect the board from lawsuits challenging the institution of a drug testing policy. Insurance on this scale is expensive, but we heard no detail of these costs. Then again, with self-professed brain damage, Mr. Evans might have just forgotten the numbers. The most interesting part of this event was observing the audience of school administrators. They came from all over New Jersey and were all clearly concerned about drugs in their schools. There seemed to be a sense of helplessness there, that these people in charge of our youth were somehow not in control. Darkly telling, there seemed to be an us and them mentality between school officials and their students. The attendees genuinely wanted to help students and improve their school environments overall, but more than anything, it seemed they wanted to be proactive, to do something, anything, to combat a problem that they feel they have no control over whatsoever. None of the administrators would speak to me in an interview for NORML, but standing in front of the hotel, one saw my NORML button and mentioned that she had been a member of NORML in the past. I asked if she was thinking about doing drug testing. Yes, she replied, and quickly added the problems at her school were with meth and not with pot. This made me realize why marijuana legalization is so vitally important. Right now, a teenager could smoke a joint at a party, get randomly tested a month later, and show a positive result. In an even worse case scenario, a teenager who smoked a joint up to 4 weeks prior could arrive at school, taking a prescription from a doctor. A school administrator may think the student is intoxicated from the prescription and institute a mandatory test. Once this is put into motion, no one, not even the parent, can halt the process. The student then tests positive for marijuana metabolites and is remanded into treatment. In New Jersey, if you test positive for drugs by a school-initiated drug screening, the student must be put into treatment and counseling. If the parents refuse to do so under New Jersey law, they can be prosecuted for neglect. All of that could happen from a student smoking marijuana once at a party. And smoking marijuana once at a party is something that almost 97 million Americans say is an activity they have participated in once in their lives. While the prohibition enforcement presenters spoke of marijuana, it was clear to me that school officials were concerned about other drugs. Marijuana presents no threat to this audience's most pressing concern, student death. But heroin, meth, alcohol, and other drugs certainly present a growing threat. That is what these administrators wanted to stop. They do not want to see students dead. Even Dr. Madras and Mr. Evans had to go into sophisticated nuance to point out any threat from marijuana, and this is their job. So it seemed to be there was a general understanding that marijuana is not harmful on the level of even alcohol. The only real way to focus federal, state, and local school resources to stop teenagers from using killer drugs is to make marijuana non-criminal and educate the public about the real effects of marijuana. Education would show that even in cases where someone seems dependent on marijuana, they do not require the same type of care and resources as those addicted to killer drugs like alcohol or heroin desperately need. Requiring teenagers to go into treatment for marijuana is a travesty of science and politics. It's clogging our already strained treatment system so that many of those trying to free themselves from killer drugs like meth never get the chance to receive treatment at all. Across the country, people are sending their teenagers into drug treatment programs for marijuana because they're required to and fear local prosecution for neglect. Kids are certainly not becoming addicted to marijuana, but in the past, if a teacher smelled marijuana on a teenager, the school and parents could work together on a solution for the student. Now, akin to mandatory minimum sentencing, the decisions are taken away from parents, and the teenager is legally required to enter treatment or counseling. One of the prohibitionist mantras of late, direct from the DEA and ONDCP, is saying that more teenagers are in treatment for marijuana than ever before. But clearly, these numbers are being inflated by prohibition policy itself. Marijuana legalization is the only way to protect children in schools from the growing threat of killer drugs. At the same time, it will decrease the amount of young people who smoke marijuana as well. All advocates of marijuana legalization agree that the model to follow is currently in place for alcohol, with strict age thresholds for purchasing, as well as strict control on where it is sold. Treating marijuana like alcohol would go a lot further protecting kids than drug testing the baseball team. The ONDCP wants school officials to believe that random suspicionless student drug testing is a magic bullet to solve their drug problems. The reality is that these programs are expensive and ineffective. Worse yet, it gives parents and administrators a false sense of security about their children and their school environment. Mr. Evans pointed out that in a school of 1,200 students with an extracurricular random testing program, about 80 students would be tested per year. Interestingly, he pointed out that most programs only yield 2 to 3 positive results annually. So out of a school of 1,200 kids, only 3 are caught and sent into treatment for the potential cost of hundreds of thousands of ONDCP-supplied federal tax dollars. Clearly, if we are willing to spend hundreds of thousands of dollars on just a few students struggling with drug addiction, there must be some way to find hundreds of thousands of federal dollars to spend on every student in America. Again, this is where marijuana could help. The tax revenue from the regulated marijuana market in the United States could easily fund treatment for killer drugs, as well as broader school programs and increased extracurricular programs. More than ever, my trip to the ONDCP Drug Testing Summit reinforced my belief that legalization and regulation of marijuana is the only comprehensive change we can make to protect children and improve America's schools. Anton Barbeau there with Drug Free. He's got an album by the same name. We're using it as sort of satire today to go with that Twilight Zone experience I had yesterday in Newark at the Drug Testing Summit. We found that track up at the Independent Online Distribution Alliance. You can find links to all of the music we use as feature tracks, as well as background artist musicians, up on our website at normalaudiostash.com. Wednesdays here on the Audio Stash, we get to talk about the science of cannabis with Dr. Mitch Earlywine. Mitch is professor of psychology at State University of New York and author of the book Understanding Marijuana, A New Look at the Scientific Evidence. Mitch is also editor of the new book Pot Politics, and we have links to the books at normalaudiostash.com. Mitch, welcome back to the program today.
Thanks for having me again.
Great to have you back with us this week, Mitch. We covered the big news about the DEA administrative law judge ruling that the DEA improperly rejected the proposal from Dr. Lyle Craker at the University of Massachusetts at Amherst to grow medical marijuana for research purposes. So, Mitch, as someone involved in the realm of marijuana research, why is it so important to have this competitive grade of marijuana out there? Why not just let everyone have the NIDA marijuana from the University of Mississippi?
As it turns out, we're learning more and more that different strains of marijuana have potential for very different effects. Right now, the University of Mississippi only has really one strain of cannabis. There are really only a couple of strengths. The highest strength marijuana available from them is 8% THC. In Amsterdam and the Netherlands, this wouldn't even qualify for medical use. And in truth, we just need to have multiple laboratories working on these problems so we can really get a feel for the plant physiology and all the potential for medical cannabis. I'd like to emphasize, Chris, that Dr. Craker is not, Ed Rosenthal or Jorge Cervantes. This is a guy who got his bachelor's degree the year I was born, who has advanced research degrees in plant and soil sciences, who's been doing things on corn and other spices. This is not a guy who's just devoted to cannabis, but a really accomplished scientist with lots of federal funding on a lot of topics related to this. I've also spoken to people about his laboratory space, and it is arranged so that the cannabis would be completely safe under, multiple locks in an extremely safe setting. It's not like this is going to be out in some open field that UMass Amherst undergrads are going to go raid or something like that. This is really an accomplished researcher with the appropriate facilities to make this happen once he can get this Schedule I clearance.
And Mitch, if this second source were available, do you think that more research could be done in the United States on marijuana and cannabinoids?
Absolutely, and in fact, the work that's being done now would improve so dramatically. I believe we've talked before about Don Abrams having people come to his lab to use the NIDA cannabis in his research, and these folks drop out because the cannabis is really not of the quality they can get in San Francisco and other areas. Obviously, if you're getting these people to drop out of your studies, you're not getting the kind of data you really need. And if we had just an opportunity to get more people involved in experimenting with different strains, this could be a huge opportunity economically for the United States. We could really be the forerunners in basically cannabis science and in developing the kind of strains that would be the most appropriate for medical use and, providing our ill people with really the best opportunity to relieve their symptoms.
And Dr. Craker and MAPS, the Multidisciplinary Institute for Psychedelic Research, have taken on this almost decade-long journey with this particular proposal. Mitch, would it help if more researchers embarked on that process?
Well, as it turns out, cannabis administration in the laboratory is very difficult to work out. You have to get approval from not only the DEA, but also from NIDA in order to get the cannabis. And this is often a multi-year process no matter what. So if there were an alternative source, of course this would help. I think the things that researchers and private citizens can do is really do everything they can to support Dr. Craker, since he's already laid so much groundwork on this kind of work. And he is really an accomplished person who would be the appropriate person to grow this material. And rather than a bunch of other people trying to apply for comparable licenses, let's all get behind this guy who's definitely qualified and make sure he can get the kind of resources he needs. It's not as if he would limit himself to a single strain. He understands how the cannabis, physiology is very important to study, and he could do a whole bunch of variations in the space he has and provide cannabis to the laboratory researchers who really need it for medical uses, or to study the impact of intoxication on other behaviors that we're all intrigued and curious and eager to discover.
And just to be clear here, this proposal to grow marijuana at the University of Massachusetts with Dr. Craker, this marijuana would not be supplied to individual patients, but would be grown purely for research purposes.
As I understand the application, it was really to just provide an opportunity for an alternative source other than this Mississippi source. This is the kind of monopoly that drives most Americans crazy, and we don't want to see this lack of competition in a situation like this. I understand the DEA's desire to keep these kinds of things under their own control, but in truth, to have two laboratories do this rather than one is not asking for a lot. This is not like opening up 1,000 dispensaries or something like that. This is just an opportunity to get alternative strains grown in another source, and to sidestep some of the problems associated with having all this pressure on the University of Mississippi folks to provide cannabis to every researcher in the United States who's interested in doing that kind of work.
And Mitch, we hear a lot about that federal government growing program at the University of Mississippi. Can you tell us more about that? I mean, how is it physically set up, and how much do they produce?
This is one of those sort of underground secrets that everybody has developed urban legends around. It's very much like any other kind of, growing of hay or growing of any other kind of laboratory plant. So it's not some big elaborate field, or there aren't people standing around with guns or anything like that. It's very much just a few areas where cannabis is grown. Unfortunately, getting estimates of how much they produce each year is very difficult, and not something that is public knowledge. They do have a placebo, basically a DTHC'd cannabis, if you will, that's 0% THC. They've got one that's a relatively low dose, compared to their alternatives, which is around 4% THC, and then another one that's about 8% THC. If you talk to folks who've used these, in administration in the laboratory, they will say it's very seedy, it's very stemmy, it's not the kind of thing that most folks are used to smoking who are recreational users. And that makes us have to wonder, well, how well do these data even generalize to the cannabis that the average American can get their hands on and, would purchase themselves? And sort of under those circumstances, wouldn't it be better to have at least the University of Mississippi increase the number of strains that they're willing to produce, or let somebody who is also really well trained in the soil sciences to take over another, set of seeds, another ability to produce better plants, and make this happen in a way that can make our research more appropriate and better able to generalize to the cannabis that's available in the United States now.
So, Mitch, let me get this straight. The official science that we hear from the government regarding marijuana has only ever looked at this marijuana from the University of Mississippi. I mean, there are these Oregon Medical Cannabis Awards and medical cultivators in California, and we don't even look at some of the best plants in our official science.
There are no formal data on those strains because we can't get them into the laboratory. Now, folks like Valerie Corral and people like that who do provide medical cannabis in states where it is more permitted have been taking really, careful survey work before they were rated and trying to make the best use of that information they can to help people move towards strains that are more helpful given the symptoms they report. But that work is extremely informal, and as we're discovering, other than, say, GW Pharmaceuticals, who manipulate cannabidiol and other cannabinoids in the different plants that they have, we really have no data on anything other than this one strain that is available through the University of Mississippi. And so to say that cannabis does or does not have medical effects based on that one strain would be a lot like, saying any other medication that we only did in a single form had medical effects or not based on really just a single form. And that's an extremely unfair way to evaluate the medical potential of any medication, and just clearly a bad way of going about making the best health decisions for those Americans who are suffering from all these ailments.
Well, Mitch, this has been a fascinating discussion. As always, I really appreciate you joining us to talk about this week.
It's always a pleasure, Chris, and I hope folks are willing to go ahead and check out Dr. Craker's website or anything along these lines to help out in any way they can.
And we'll have links to that site at normalaudiostash.com. Mitch, thank you again. Wednesdays here on the Audio Stash, we get to talk about the science of cannabis with Dr. Mitch Earlywine. Mitch is professor of psychology at State University of New York, author of the book Understanding Marijuana, A New Look at the Scientific Evidence, and editor of Pot Politics. We have links to those books at normalaudiostash.com.
755,000. That is a big number to be sure, but do you know what this number represents? It signifies the total number of citizens in America arrested on marijuana charges in 2004. That's right. 755,000 of your fellow citizens were arrested on marijuana charges. That's an arrest every 40 seconds, and 9 out of 10 of those arrested are for possession-only charges. Does continuing marijuana prohibition make sense to you? It certainly does not to the National Organization for the Reform of Marijuana Laws and its members. I'm NORML's Executive Director, Alan St. Pierre, and if you too think that it is high time to end marijuana prohibition and replace it with a tax and regulate policy, please join and support NORML's 36-year legislative efforts to reform our country's misguided marijuana laws. You can learn more about NORML or become an active supporter by calling toll-free 888-67-NORML, N-O-R-M-L, or by visiting us on the web at NORML, N-O-R-M-L.org.
Listening to NORML's Daily Audio Stash, the growing truth about cannabis. Make sure you visit our website at normalaudiostash.com. That's NORMLAUDIOSTASH.com for more information about every day's show. I'm your host, Chris Goldstein. Thanks for listening today. See you at 4:20 tomorrow. Podcasting technology of NORML is made possible by Red Aphid Interactive Media. More information at redaphid.com.